moms across America, and we're here at the Environmental Health Symposium in Scottsdale, Arizona, and I am absolutely thrilled to be here with Joe Pizzarno, right? And Emily Givler. And can you give us your background and your titles?
Sure. So my name is Dr. Joe Pizzarno. I'm the founding president of Bastyr University, the first great university of natural medicine anywhere in the world. I'm also the author of 7 books for consumers. This one's on environmental toxins, and 6 textbooks for doctors. And I've been very active in this field for a long period of time. I'm a naturopathic physician, which means that I believe that the route to helping people become healthy is to help them understand what nutrients they need in their body and what toxins they got to get out of their body.
And speaking of getting toxins out of our body, Emily Givler, tell us your background. Just talked about glyphosate and mold and oxalates and sulfate and all of this. It was really fantastic talk. So please tell us your background.
Sure. Well, thank you. I am a functional genetic nutrition consultant, so I specialize in digging deep into more complex cases to determine where there may be underlying genetic factors inhibiting things like the ability to move toxins out of the body. I'm actually a founding board member of GMO-free Lancaster County as well.
Oh, great. Thank you so much. So the big question is glyphosate actually harming our genetics and our health? And that's what part of what your talk just addressed. Can you give us a little summary of what you just addressed in your talk?
Sure. I don't know that we could really say that that glyphosate is harming our genetics, but because of our genetics, glyphosate could potentially be much more dangerous for some individuals than others. So there are a lot of reasons that glyphosate is a very toxic substance, but one of the easiest for a lot of people to understand is that glyphosate is metabolized into oxalate, and if you get too much oxalate in your body, it's going to push sulfate out. And sulfation is critical for many different aspects of detoxification. So the more glyphosate you have coming in, the less you are able to detoxify through these normal pathways.
And what would somebody see if they have low levels of sulfate, like you're talking about, and high levels of oxalate? What type of symptoms would there be in their body?
Talking oxalate, we're not actually thinking about things like kidney stones. We're thinking more of retained oxalate, which tends to be in the peripheral tissue. So often you'll see presentations like fibromyalgia with widespread musculoskeletal pain. You may see more advanced pathologies like pulmonary fibrosis has been associated with excessive oxalates. Breast cancer is associated with excess oxalates. For people who have chronically low vitamin D levels, sulfate is needed to metabolize vitamin D. So we may see on lab testing low vitamin D. We may see impaired glutathione synthesis. In advanced cases, you could get to the point of jaundice, but that would be a kind of an end stage indicator.
And jaundice is meaning impacting the liver.
Yes.
Right. Yeah. So and Joe, in your research and all of your naturopathic studies and teaching everyone, is this what you're seeing? Is that the toxins and obviously your book Toxic Solutions, that glyphosate is a major factor of what's going on in health in America today?
So I look at glyphosate a little differently than other people do, and that while glyphosate is toxic, it's actually for me a marker of consuming foods that are high in high levels of pesticides and low in nutrients. Because these are genetically bred to be able to resist the glyphosate and kill off all the weeds and things like this. But in the process of doing that, you can then put way more pesticides on it. And one of the reasons why these plants need more pesticides is because they're so nutrient depleted themselves, they're less able to resist the environmental, the insects and such that want to eat them. So you have foods that are poor quality, low trace nutrient content, and high levels of toxins. And this is pretty significant. So we look at, for example, high levels of toxins is something we were talking about last night at dinner. So if you look at children born to women, in the top 10% of body load of organophosphate pesticides, one of the most common class of pesticides, and comparing to children born to women with the lowest 10% organophosphate pesticides, and you iron out all the socioeconomic differences. So we'll just look at that one factor. They have a 7-point lower IQ. And those kids with highest levels of organophosphate pesticides, 3 studies have now shown 7-point lower IQ. One study followed these children for 7 years, they never got it back. So
that's significant. I just want everybody to get that. So feeding your child an organic diet can actually give them an advantage, an intellectual advantage for the rest of their lives.
Yes.
I don't know about you, but I think that's worth it. And it may be difficult to find organic for some people, but it seems like making the extra effort to do that would be worth it. And frankly, as a national sort of economic issue, you would think that the government would be interested in having organic food available for all of our children, so that they also have the intellectual advantage, right, to contribute to our society. So that's a very important issue.
Yes.
So I'm curious what you thought of Emily's talk, seeing I couldn't understand half of it, but I'm sure you did. So what did you think of Emily's talk?
So as I said in the question and answer period, I thought it was actually excellent, which is why I invited her to give me a case history for my journal. I'm the editor of a PubMed Index journal on integrative medicine. So I want to add a little more to what I just said, and that is, so I lecture on this environmental medicine literally all over the world. And so when I go to a new country, I always look and see what's their toxin exposure, and pretty much the whole westernized world is full of toxins. And so I start my lecture by saying, how many of you have been told by your families and friends that you're stupid for wasting your money buying organic grown foods because they're more expensive? And most people raise their hands. And I look at them and say, you know something? Not only are you smarter, your children are smarter, because we're not damaging them. This is, and you look at things like Alzheimer's disease and all these, we're seeing all this dementia developing. People at the highest levels of these toxins lose their brains more quickly, because it basically damages the neurons, and the neurons stop functioning, and now you get Alzheimer's disease.
Yeah, so that reminds me of what Dr. Seralini said yesterday too, is that these endocrine disruptors are not just endocrine disruptors, they're neurotoxins as well,
Exactly.
because of their hormonal effect and the effect on the nervous system. So this is really a huge issue for our entire body. It's not just one area. It's very important. And can you give us a little tidbit of what you're going to talk about later today?
So I've been for a number of years now trying to answer the question, what percent of each chronic disease is due to specific environmental toxins? So for example, diabetes. So when I was in naturopathic medical school half a century ago, diabetes affected like 1/2 of the population. Now it's 15 or 20%. What happened? Our genetics didn't change. People say, well, it's because of sugar. Well, actually, our sugar consumption didn't increase either. Then people say, well, it's because everybody's obese. And it's true, obese people have way more diabetes than non-obese people. But obese people in the bottom 10% of environmental toxin body load have no increased risk for diabetes. And thin people in the top 10% of body load of environmental toxicity, 35% of them have diabetes. So is it the obesity or is it the toxins? And the answer is the toxins. So I'm going to go through disease by cancer of all these things that are epidemic, becoming more and more common in our society, and we'll show out every one of them is primarily because of environmental toxins. I want to be clear, I'm not saying nutritional deficiencies as a problem have gone away. They haven't. It's actually gotten worse.
Yes.
But we've added another even bigger problem on top of it. So we have a huge problem here. Right now, diabetes accounts for 1/4, 25% of healthcare costs in the United States, and it's going up. Within about 10, 15 years, is my best estimate, treating diabetes will now take up over half our healthcare dollar. It's going to bankrupt us. We can't take care of people with diabetes anymore.
Yeah, we have to stop that, and that's just diabetes. That doesn't include cancer and heart disease and so many other issues that we have going on in America today. So we're in a real health crisis, and I'm just thrilled though that there are doctors like you and researchers like you that are bringing this very valuable information to the broader public. And it's just very exciting for me as a mom who I feel like I've been fighting about this for so long to see doctors on our side and really reaching out to people. So is there anything else, Emily, that you want to say to add to this about glyphosate? There is hope. You mentioned that there's a program that you can do. You can have patients go through it, and you can increase the sulfates and reduce the oxalates. All that.
There's so much that we can do. So complacency is not the answer. We can shop organically, and organic is really the way to go, because even with the non-genetically modified crops, we're still using just massive amounts of glyphosate as a desiccant, typically within about the last week of the growth cycle in order to kill the crops. Grain crops are the big ones, so things like oats and sugarcane. So those are big things to look for organically. And in doing that, we can reduce the incoming amount of toxins, but we can increase our sulfate sources as well. And this can be things from like organically grown cruciferous vegetables, or Epsom salt soaks, or nutritional supplementation to replenish sulfate stores. You can also upregulate certain pathways, but it's probably a good idea to work with the appropriate practitioner to do that, to determine your individual relative risk. But all of us can stick our feet in a tub full of Epsom salts for 20 minutes, 3 days a week. without breaking the bank. So yes, organic costs a little bit more. Grow your own. Then you don't have to worry about it. Then you don't have to worry about cross-contamination and things like that. So grow your own food, even if it's just a bucket with a tomato plant in it. You're moving a step in the right direction. And then when you're done with the tomatoes, put some Epsom salts in that bucket with some water and stick your feet in it for 20 minutes.
Really fantastic. I'm glad she mentioned grow your own too. I was talking to Dr. Michelle Perro last night, and she was saying that because of the fracking water being used so often in the United States, that kale and many of the cruciferous vegetables, or the cabbage plant family vegetables, are showing up with thallium and cesium, I believe it is. And cesium, so which are neurotoxic and radioactive and all that. So if you can grow your own kale and grow some of your own broccoli and things like that, that would really help a lot. And just making sure to choose. I think asparagus was mentioned as a really good vegetable to have too by one of the previous doctors. Is that correct? Is that what you heard? Okay, great. Well, we could talk all day, but I just want to get a little tidbit from both of these amazing people. Thank you so much, and thank you to the organizers and the volunteers here at the Environmental Health Symposium. It's a truly wonderful event, and we appreciate you watching today. Thanks so much.